7 warning signs. Your dog needs a vet. Every dog owner knows their dog better than anyone else. You know their habits, their personality, their favorite sleeping spot, and exactly how excited they get when it's time for a walk. That's why one of the most important skills any dog owner can develop is recognizing when something isn't right. Dogs are incredibly good at hiding pain and illness, which means serious medical conditions can sometimes go unnoticed until they become emergencies. Today, we're going to discuss 7 warning signs that may indicate your dog needs immediate veterinary attention, and recognizing these signs quickly could potentially save your dog's life. If your dog appears to be struggling to breathe, this should always be treated as an emergency. Healthy dogs should breathe comfortably and effortlessly while resting, so heavy panting in cool weather, rapid breathing, wheezing, gasping, or blue-tinged gums can signal a serious underlying problem. Breathing difficulties may result from heart disease, pneumonia, allergic reactions, heat stroke, airway blockages, or fluid accumulation in the lungs. If your dog seems to be fighting for every breath, don't wait to see if the situation improves on its own. Seek veterinary care immediately. Sudden collapse or extreme weakness. A dog that suddenly collapses or becomes extremely weak may be experiencing a life-threatening medical emergency. Conditions such as internal bleeding, heart disease, severe infection, poisoning, shock, or dangerously low blood sugar can cause a dog to lose strength without warning. Even if your dog appears to recover after a few minutes, the underlying cause could still be extremely serious. Any sudden collapse or unexplained weakness warrants immediate veterinary evaluation. Bloated or swollen abdomen. A swollen or tight abdomen is one of the most dangerous emergencies a dog owner can encounter, especially in large, deep-chested breeds. One particularly deadly condition known as bloat occurs when the stomach fills with gas and may twist, cutting off blood flow and rapidly becoming fatal without treatment. Signs often include a visibly enlarged stomach, restlessness, excessive drooling, unsuccessful attempts to vomit, and obvious discomfort. If your dog's abdomen suddenly becomes swollen, emergency veterinary care is critical. Continuous vomiting or severe diarrhea. Occasional vomiting or mild stomach upset in dogs can happen, but when vomiting becomes continuous or diarrhea becomes severe, it may indicate a serious underlying condition that requires immediate attention. This can be caused by intestinal blockage, poisoning, pancreatitis, infections, or organ-related diseases. If your dog is unable to keep water down, shows blood in vomit or stool, or becomes extremely weak and lethargic, dehydration can develop very quickly, and the situation can become life-threatening. In such cases, waiting too long can significantly increase the risk, so immediate veterinary care is necessary. Seizures. A seizure is one of the most alarming medical emergencies a dog can experience, and it should never be ignored. During a seizure, a dog may collapse, lose consciousness, paddle their legs, drool excessively, or lose control of their bladder. Seizures can be caused by epilepsy, toxin exposure, liver disease, brain disorders, or serious metabolic imbalances. Even if a seizure lasts only a short time, it is important that the dog is examined by a veterinarian as soon as possible, especially if it is their first episode or if multiple seizures occur within a short period. Abnormal gum color, pale, blue, or gray gums. A dog's gum color is one of the fastest ways to detect a serious health problem, as healthy gums should always appear pink and moist. When gums become pale, white, blue, or gray, it may indicate oxygen deprivation, internal bleeding, severe anemia, shock, or heart and respiratory failure. This symptom often appears alongside weakness or unusual behavior, and it should never be taken lightly. If you notice any sudden change in gum color, especially combined with lethargy or difficulty breathing, immediate veterinary attention is required. Possible poisoning. Poisoning in dogs can happen quickly and often without warning, making it one of the most dangerous emergencies. Many common household substances such as chocolate, xylitol, certain medications, grapes, antifreeze, rodenticides, toxic plants, and cleaning chemicals can be extremely harmful or even fatal to dogs. Symptoms may include vomiting, tremors, excessive drooling, difficulty walking, seizures, or sudden collapse. If poisoning is suspected, it is critical not to wait for symptoms to worsen, as early treatment can make the difference between recovery and death.